So my name is Dmitry Wolfovich. I'm a licensed marriage and family therapist here in downtown San Jose. Well, just to give some background about myself, so I went to John F. Kennedy University, is a graduate program for holistic studies in psychotherapy and counseling. And my final paper or my thesis was it's called ethnobotanical assisted psychotherapy. So I studied the production and use and cultural component of medicines in other cultures other than the Western society, and the benefit that I see and learn and experience myself through psychedelics and particularly psilocybin is that it has a much stronger therapeutic effect than what the current sort of established psychiatric modalities have to offer with regards to depression and things like that, dealing with PTSD and other issues. Uh, Currently, the medical model is insufficient in treating people, and I think that what's happening is sort of like a renaissance or revisiting of the old holistic modalities, and really an old form of psychiatry that has been practiced for thousands of years by shamanic cultures. And these substances are extremely powerful psychoactive medicines. And so why is psilocybin effective or useful is because it helps the person to heal and unlock certain hidden or sort of compounded aspects of maybe pain or old trauma that they've experienced, and really kind of brings it to light. The latest research shows that it leads to neuronal growth, and that it can benefit people with memory loss and dementia. Um, but as far as and that's in sort of a nano or microdose level. As far as the increased dose, people have an experiential sense of consciousness expansion, and they feel like they have ideas that come to light or have more insight about their life or create connections within their life story. So it does bring insight and sort of a larger awareness of yourself. The difference between dosages is that it has a different effect. And this goes back to the work of Terence McKenna and his research on how the sort of the theoretical or historical, prehistorical study about how hominids may have evolved through before history, and he postulates that sort of this early hominid may have taken mushrooms to evolve. And what he talks about is that when most likely when they experimented with psilocybin at low doses, psilocybin increased edge detection, and so their ability to hunt and pay attention was much stronger, to have much more vigor and strength. And so at low doses, it definitely increases the awareness and mindfulness and ability to pay attention and focus. And as you increase the dosage on an experiential level, it starts to lead more into an introspective state. So you have a sort of a slowing down and a deeper awareness of your interiority or your inside space, and you start to see more vividly inside of yourself. And at higher and higher doses, you start to actually visualize the sort of modalities of your imagination and start to almost experience a dream world, similar to the one that you see when you go to bed, but in an awaking state, and leading to mystical and spiritual experiences that as you would have through your religion or something like that. So basically, this is how it works. When a person experiences something traumatic, they that memory gets sort of encapsulated into their body, and they usually have some kind of like tension or their body remembers it, and they also remember it mentally too. And so what happens is somehow they get through the trauma, And then eventually that trauma starts to come back up as symptoms, um, like nightmares or being startled or fearful or panic attack or any of those things, anxiety, depression. And so with the medical model, the regular SSRIs, antidepressants, what their approach is to sort of subdue the nervous system, subdue the mind into kind of reducing those symptoms so that the person can function. Mm. And so that they don't experience as many panic attacks or as many nightmares, or they can take other pharmaceuticals like antipsychotics and things if they're having kind of like too many nightmares or something like that. But all that does is just basically kind of reduce the symptom. But from the holistic perspective, the idea is that the reason why the symptoms are there is that basically your nervous system is like, hey, there's something that needs to be healed down here, and I'm just alerting you, letting you know that. Mm-hmm. It's very similar to if you're walking down your living room and you stub your toe on your couch. The nerves are there designed to tell you, hey, there's pain in your toe, you need to attend to it. Well, that's not very different from emotions. Mm-hmm. Your anxiety is designed to let you know that if you're not safe, or if you're in a dark alleyway, you're supposed to like turn and look around. So all symptoms are really actually designed in your body to let you know that there's something unwell or uneasy within you. So the same thing with a nightmare. A nightmare is just saying, hey, like there's something that I'm upset or fearful about, and I'm letting you know that. And so looking at from that holistic perspective, how the psychedelics work is that they help to bring out the root and core of that pain, and allow and help the person who's taking the drug, the medicine, to take a look at it and to actually heal it from a different perspective. And part of that is that the medicine allows you to, because you're in this altered state, you're able to kind of not be taken hostage by this like frantic emotional state, but you're almost able to see it like if it's a movie, and with a sense of fascination with yourself. Although the psychedelics can be scary, there is a certain component of like an observing of your life, and there's a certain sense of detachment. And so that's how they work. They actually address more of the root cause of the disease instead of acting as a certain way to get by or patch it up. Now, just a disclaimer, I'm not against, I'm a licensed emergency family therapist. I'm not against psychiatry or medication, and I think they're very useful in the sense that sometimes when you're in crisis or people need it to get through a certain moment. But if you're looking at like the eventual and total well-being and really getting on your own feet and clearing out trauma, and the psychedelics are by far the most superior thing you can use as an aid to assist you in healing. By virtue of what the psychedelic experience on a more philosophical and spiritual level, what it does is it destroys the ego. It kills the ego, and the easiest way to understand what that means is the ego. The definition of ego really is like self-concept. So it's a symbol that you give yourself. So you may say, I'm a painter, or I'm a computer programmer, or I'm a victim of trauma, or I'm I'm an introvert, I'm an extrovert. These are all conceptual identities that people have, and that's what the ego is. And so a person may be identified with like maybe a rape, maybe they identify as a rape victim or a victim of war or something like that. And they're so embedded into that identity that becomes their life, and they become stuck and strangled by that identity and what that means for them. And so sometimes what the psychedelic experience does is that especially when you're under a high dose, the person, it gets so expansive in their self-perception that they, at least for that moment of 5 or 6 hours that they're tripping, they actually see themselves as so much more, and maybe their identity is much more one that is cosmic and expansive, that they identify with more like with the stars and the mountains and even just everything else around them. What they do is they grow out, at least temporarily, outgrow that identity, and they're no longer limited by that being that identity structure, and they're able to see that, well, I'm not just that. And that within itself is healing, because when you can detach from that limiting self-identity or ego, you can actually outgrow and become bigger than your problem. So your trauma may still be there, and you will still have the pain, but you will be much more expanded in yourself, in your sense of self, that it won't be like all there is. You won't be consumed by that identity. And that's the best way to describe it. I like to quote the psychiatrist named Gabor Mate. He says that the biggest gateway to addiction is trauma. And most people that lead to taking like hard drugs like heroin and things, that or become addicted to alcohol, don't get there because they try different drugs out. They get there because there's an immense amount of pain deep inside that they're trying to soothe, and they are looking for some relief. Um, the, the psychedelics actually are used to combat drug addiction, and rather there's all sorts of studies with smoking and alcoholism and cocaine and LSD and other psychedelics have been used to treat that, because it helps you become so introspective that you realize that you're clinging on to something and you're trying to escape or soothe with some other drug. And so it's quite the contrary. And furthermore, it's funny that it's completely outdated that people even group psychedelics in that category, because you never hear about somebody who's addicted to mushrooms. Primarily because taking mushrooms is completely uncomfortable, completely unenjoyable, and really not something that you can really cling on to, because it's completely self-confrontational, and it isn't something, from my experience and anybody that asks you, it isn't something that they would want to keep doing. Usually when people take mushrooms, they probably usually wait a month or so, because they're like, whoa, what was up? What happened to me? So they have the most minimal susceptibility to addiction. That's what's so great about them. As far as like the actual indigenous people, um, I think that it's good that the Western people, also take responsibility and use this stuff on our own terms, because um, we have to understand our own diseases. We can't go, because a lot of times the Western people would go down to Peru and take psychedelics and with the shamans, and the shamans are operating under their own cultural paradigm. They only provide what they know. They don't know our pathological intricacies within our culture, and so oftentimes people come back and maybe they feel a little bit unsupported. Especially I've heard with people with, like, for instance, PTSD, or if they're female, they need special attention and a little bit more curtailed to somebody like a psychologist would understand, particularly with journeys like with Hikuri or peyote from the Huachal tradition in Mexico. It's very strict. It's a very strict circle around a campfire where you can only talk or move or get up at certain times according to certain rules, and it's really not a place for crying or grieving or rolling around or getting emotional or asking for help. And so some of these indigenous practices are sometimes not really conducive for a Western person who's really needing help with their PTSD or some kind of emotional experience. And so I think it's good that the indigenous people keep their practices as a sort of cultural heritage, but I think that the Western people need to also really establish and expand on their own ways to use this stuff, because when we know our own problems, when we know our own issues, the indigenous people didn't even suffer from drug addiction before Columbus and all the Western people came. They didn't really have any mental health issues, really. It's all kind of our own Western pathology that we brought upon. So I don't think it'll impact them. I think maybe it might even lighten the load from what they're doing and all the people who are going down there to get help. So there have definitely been categorizations of more usefulness with certain particular psychedelics. They've kind of carved out a niche for themselves. So particularly with MDMA, like that's been really like a strong cornerstone for treating trauma. They're doing a lot of research with war vets and people with gone to sexual abuse and things like that. Because what the MDMA does, and MDMA is actually not an indigenous medicine, it's actually kind of a Western concoction, and it was originally used as a couples therapy drug in the 80s. It used to be legal, it used to be part of psychiatric treatment, but became a party drug and kind of became illegal. So that one is actually the first one to become on its way to become legal as a treatment because it already has a basis for treatment. But why it works so well for PTSD is when you ingest MDMA, you immediately become very sentimental and naturally very loving. There's a lot of like serotonin and things that flow through your body, and so you can't help but be very like loving and lighthearted and sentimental and positive. That's what it makes you do. And so it works so well with PTSD is because when a person's on MDMA and the therapist invites them to look at certain trauma or a past experience, it's like if they're remembering some kind of difficult situation, their level of perception of that situation is through this canon of love. And so they're able to like blast unconditional love and fascination at their own past memory and really change the way that they see it. And it gives them the opportunity not to break down and get fearful because the drug is so powerful in making you so positive and sentimental and loving. So it's really perfect for looking and revisiting old things because you're in such a loving state. And it changes the way that your relationship to those past memories because you've done it differently. So that's MDMA. I think particularly like psilocybin is one of the most versatile ones because it can act as MDMA. It can also do that. It can also soften you up and make you feel a lot more lighthearted and loving. But also, obviously, psilocybin has the potential at high doses to lead into a spiritual or psychedelic mystic state. And all psychedelics have this potential for spirituality. Ayahuasca is a really good one also for trauma and depression. Ayahuasca is a little bit more conducive for groups because that's how it was traditionally used, and so there's a lot of people doing it that way. And then the what has taken precedence for drug treatment is ibogaine. That one is really powerful. It detoxes the body. It cuts down cravings. I forgot what was the latest statistic, like I don't know, like 60 to 90 days or something like that. It's really positive. And ayahuasca also is used for treatment of drugs and alcohol too. But yeah, those are kind of the main groupings. What I teach people when they come in to see me is to develop a mindfulness practice using body scanning and other ways to attend to yourself, because I think that the treatment doesn't end with just taking this medicine. Okay, it's actually just an aid along the journey, but there is also a lot of other self-determined practices that are involved, and mindfulness is probably a prerequisite. It has to be used to continue to be introspective, also to look at your dreams, and to really make meaning of the experience and not to just rely on it as a mood enhancer. It's required that you take a self-determined approach towards the healing experience because the psychedelic session can help you to gain insight and really experience a state of being that is much more joyous or clear or peaceful. But that's all it does. It shows you and models for you a way that you can be, but it doesn't chemically give you that once you come down. Once you come down, you're back to your normal. So all you have is sort of this something to pull from of like, oh yeah, I remember how I was or how I can be in life. And so that's where the mindfulness practice comes in, is that you have to start to practice and really pull into like, okay, what was my state of mind? How did I get myself to a state of peace? What did I do? Did I let go of something? Did I not hold on to my resentment, or did I let go of my pride? Or so you have to actually participate in the experience if you really want it to be long lasting. It can't just be, well, I took this pill and now I'm expecting to chemically it do the work for me and I'm just going to be happy. And I think that's actually one of the pitfalls of people taking psychedelics, is sometimes they have this false impression that somehow they're going to check this box and they're going to like go do this ayahuasca or go do this MDMA or take these mushrooms and somehow it's going to magically cure them. That's not how it works. You can do that. You can take the back seat to just about any treatment. With any psychiatric or medical treatment, if you don't participate and you don't really discover the process of how you're getting yourself well and how you're participating in that, it will not be everlasting. It only shows you what you can do to be more happy, but it doesn't do the work for you. So afterwards, you have to continue to do your own work and create meaning out of the experience. Particularly with a therapist would be really ideal. Somebody who's not judgmental of taking psychedelics for one, also one that can help with learning mindfulness practice. And the other thing is really important that people don't do, which I offer, is dream interpretation, because the dream world every night is not much different from the psychedelic experience, and it can be really a source of guidance visually about what's happening, because it's basically modality of the human imagination. So whatever you see in your dream, it's a reflection of what's happening inside of you, and that's exactly what happens in the psychedelic experience. I had just a gentleman that was came to me asking for help with a mushroom experience, and in his mushroom experience, he saw a woman that was like dead and on the side of the road, and it freaked him out. And he says that every time he feels sad now, he like this image comes to mind. Well, after working with them, it's like, I invited them to look at, well, that woman on the side of the road is just the creative expression of of your abandonment, of how you abandon yourself and how you've been abandoned by your dad or whatever the historical context with it. But the vision in the psychedelic experience is very similar to a dream. They're not literal visions. These are modalities of the human imagination that really give you insight of what's happening with you. And so that people need to also figure out how to make meaning of these experiences so that out of the meaning can come change. So for this person in particular, it's really an invitation to take care of himself and not abandon himself, and also look at ways to treat his abandonment from childhood. And that's all it is. It's invited him to see, like, hey, there's this pain, but you need help to figure that out, because you can come home or you can the next day you can do all about it and not find any meaning in it, and that can be really tough for you. So what I say is integration is application, because when people ask, sometimes like they think, oh, what is integration? How do I integrate my experience? Well, the most concise and straight shot definition of integration is application, because the whole idea is like, how can you apply this in your life? How can you live this experience? And one of the ways that you can apply these lessons is to actually find ways to enact it. So sometimes people will have a psychedelic experience and they'll have some kind of dragon that will come and like be their totem animal, or they'll feel like supported by this like Pegasus or some kind of strong, and they feel like a really sense of spirituality and connection. Well, a way to apply that would be maybe wearing jewelry with dragons as a way to live that and bring that into your life, or dressing a certain way, or doing something different, going dancing, but the idea is that the integration piece is to, how can I take what I've learned and apply it into my life? That's what integration means. The last thing that I want to add is that for people who are wondering how to navigate altered states of consciousness, and how to better, effectively use psychedelics, the thing that I think is most helpful is to remain body oriented, and that the way that you get lost is to be intellectually heady and trying to figure out your life out in sort of mental terms. But the more that you can stay present and connected to sensation, and if there's a certain feeling of sadness or tension or excitement, the more that you can stay in your body and present, the psychedelic experience kind of guides itself. You don't have to do anything mentally. You just stay present and things will unfold naturally. And so I think practices of mindfulness, being body oriented, is how the best way to traverse and travel with the psychedelic experience, and also how to stay sane and not lose control of your experiences, to stay body oriented. And things like yoga and dance and things that involve being in your body, working out, hiking, swimming, things like rock climbing, things that are in your body are naturally going to help you stay focused in your life and in general really healthy for you. So I think body orientation is probably the most helpful tool that I can invite people when if they're thinking about getting into psychedelics. You're not going to use it to become a philosophy. I mean, you will have philosophical thought to come to mind, but that's the recipe for disaster if you try to go into being too heady. It's more of an emotional, heart-led experience that needs to be felt through the emotions in the body, and that's the therapeutic effect of it, not so much of like some kind of validation for some quantum theory that you realize and then you come back and you don't know what the heck to do with that anymore. You're just a crazy person. So yeah.
Thank you.
All right. Thanks a lot.